Hey everyone, this is Laura Williamson from Bear Fitness. As you know, I am located in Stoneham. I am a Pilates instructor and personal trainer, and I have with me today Marika Grantham, and she's going to talk to us a little bit about beauty today, making you feel beautiful inside and out, and how she does that. And Marika, hi, how are you today?
Hi, everyone. I'm so glad to have me here. Thank you so much, Laura, for bringing me to this live stream.
It's good to have you today. And so, Marika, for those who don't know you or haven't met you yet, can you tell us the name of your spa, where you're located, and what you do at your spa?
Our spa is located in it's actually in Wakefield on a 26 Princess Street on Princess Plaza. It's pretty cool because we are in a very feminine location. When I stumbled on the name Princess Street, I was very excited. I thought
Okay.
it's a sign. The name of the spa is Shine Med Spa and Microblading, and we offer very, very wide range of services. I always wanted to have the space for people that can, for women to come and basically receive the services and be kind of like location of full makeover.
Hmm.
So we offer regular skincare, we do regular aesthetics, then we offer medical aesthetics, and then we offer also medical services, and then permanent makeup and permanent artistry.
Well, okay. So that's all awesome. I so many things. I'm not even sure where to start. Okay. So that being said, basically for all things beautiful inside and out, male and female can come visit you.
Yes, male and female can come to visit us. Yes.
And is there an age which the youngest in the that a person can actually come and see you?
Well, we see a lot of teenager girls as well, or teenager boys, but they usually have to come with their guardian. Yeah.
Okay. All right. So age is not necessarily an issue as long as the guardian, they have permission from a guardian
Yes.
to have someone
Yes.
with them.
Guardian is there and it's present and can help. Yeah.
Yes. So then, um, so you're located in Wakefield. Let me see. How did you get started? Why beauty?
So why beauty? This is a very interesting story. So my original background is actually I am trainer of psychotherapy.
Mhm.
But I always was inclined to the artistry. Artistry is big in our family. My grandmother was a painter. And so I always wanted to do something with art. So I started first doing, I love makeup. I'm very passionate about makeup and ability to transform with makeup. And through that, I started doing makeup and I started doing a couple of weddings and proms. And then obviously it was very natural that I realized I need to understand more about the skin and skincare. And that actually brought me to looking into schools of aesthetics. So I applied for Catherine Hines, which I really love in Woburn. So I went and I attended the classes. And during the day, I was still working as a director in my clinical services, and at night I was in a white apron. So it was very interesting combination of two worlds. Um, and at night I was going to night school, and then I became a licensed esthetician. And then obviously I was looking in a more a lot of females come and they have issues with the skin, and it's not necessarily just the skin as the skin conditions, but they might have some hyperpigmentation or hypopigmentation. And my sister itself has a very severe vitiligo. It's a
Okay.
skin condition with a loss of pigment. So
Hmm.
I was always looking for the way to address those issues. So one of the things that I've been doing is doing custom blended foundation. I partnered with Motives Cosmetics, and it's very phenomenal because you really, and especially these days, I want to talk to women of color as well. You can mix the foundation from darkest hue, and you can mix the foundation of lightest color. So I can have a girl with a porcelain white skin that never could find the matching foundation, and I can mix it for her, and vice versa. So that was very natural that I was working already with the pigments and color mixing. And so then I was able to dive into permanent makeup, and I attended classes with Pigmenta with Julia Ziuk Bowers in Boston.
Mm-hmm.
And that was just another way of diving into how can I address issues like that with somebody who has some type of skin condition. And it's usually something what we try to cover, disguise, make it invisible for the people outside, but it's affecting our self-esteem.
Okay.
So makeup and beauty is a huge part of how we see ourselves and how we perceive ourselves and how we feel about ourselves on a daily basis. So permanent makeup can come as a fix to do those in a more semi-permanent way, where regular makeup we use on a daily basis just to when we feel like we want to be more colorful and flamboyant with the color and playful.
Okay. So I myself, I'm finding that I'm noticing more of, people doing permanent cosmetics more now. Has it
Mhm.
always, it seems to be trending very strongly right now. Has that always been the case? I feel like it's a more of a more recent phenomena than not.
So part of it is a trend. So it's couple of things. Part of it is a trend because brows become very prominent. We women have a trend not just in a fashion but also in a beauty. They were in 80s were very thin eyebrows. They were very popular to be very thin. Everybody was doing their eyebrows, but like singer from Cranberries. Now brows are very strong and very dominant feature, and even more so these days with wearing the masks.
Mm-hmm.
So if you think about that, half of our face is really covered now.
Mm-hmm.
Brows and eyeliner and eyes are the way of communicating. So permanent makeup will have even more so very dominant place on the market, because even lips and lip tinting, lip stain and lip liners will be more needed because we don't want to smudge it on the inside of the surface of the mask. But the
Right.
brows become very trendy. I would say last 4 years. It will be shifting. It will be changing its shape. And so I just always, when I see the client, my approach is a little bit different than typical. I
Mm-hmm.
do not work with the stencils. I think what
Okay.
sets me apart is that I try to find the most natural shape of the eyebrows for the client sitting in my chair.
Right.
So I want to find out what is most complementary to their features. I want to find out what is also most natural and what is timeless, because
Okay.
I don't want to put something semi-permanent on a face and then 2 years later they will come and they will say, would you mind removing them because they are too strong or too dark? So I don't want to go through that with them. And so I try to educate them, and I also work with them in a very different approach. I am standing through whole procedure and I'm walking 360 around my client, and the client is sitting, client is holding a mirror, and they can look, and it's very interactive process, because I also want to take in consideration we have one side more dominant than the other.
Right.
Muscles are stronger on one side than on the other. So if you do and enhance the eyebrows,
Mm-hmm.
everything that is in a discrepancy and disproportion become way more obvious and visible. So
Okay.
you have to take that in a factor. So then I try to see how they move. I have them lift their brows. I have them look at them. I have them tell me, okay, like I feel like I want to have a little bit more here. So I am not fully in control. I let them to be in a control because at the end of the day they are the one wearing them. So it's different.
So I had someone tell me once with regards to the eyebrows. So eyebrows, they're sisters, but they're not twins.
No.
So I always found that one side for myself, one side always grew in very nicely, and then the other
Yeah.
side would be a little sparse, and that was
Yes.
always the trouble side. And then
Yeah.
I remember also too, I don't know if how you feel about this, but the person I used to go to, she would eat because I would do threading when I did mine.
Uh-huh. Mm-hmm.
And as I'm getting older, still even now I'm seeing changes. So she would say, one side is considered male dominant or the male side and one is
Oh yeah, yeah,
considered
yeah.
the feminine
Mm-hmm.
side. So she used to refer to that too, and she'd be like, that's so funny because this is your left side, I think she would say is considered to be your feminine side. And
Mm-hmm.
my left side would be, but the right always grew and the left not so much.
Mm-hmm.
And she would say things like that to me every once in a while, and I just thought it was
Mm-hmm.
very interesting, to say the
Mm-hmm.
least. I never, but now that I'm getting older, I'm starting to see the change. Now, the side that used to be more dominant and the other
Yeah,
side that would
and
barely grow
and
was now
and
grown.
it's not just that, but actually, most of my clients are women of mid age and higher, and the reason is we really, through hormonal changes, we are losing our eyebrows, just like our hair are thinning and everything is shifting,
Mm-hmm.
and not for the good thing, actually. So just like we are losing tonus on our face and in a skin. So there is a lot of things that we can do with that, and we can address it not just by semi-permanent makeup, but we also can work on a tone of your skin, and that's another tool that I love to use. It's called plasma pen tightening, and
Okay.
it's my favorite thing recently. And we do a lot of combos. Sometimes we have a client and one of the brow is like very tilted, and we need to help it out, and it could be helped with botox, but that's on a temporary basis because that will have to be re-injected again.
Mm-hmm.
Where if we do plasma pen tightening, I have several clients that I did actually plasma pen tightening only on one eye, and I pull it all the way up to the forehead, to the hairline. So I'm kind of creating this trend on the skin, and
Mm-hmm.
meeting where we need to meet them, and then I can adjust the strokes and work with the strokes in a different way. So I placed the one eyebrow strokes a little bit lower, the other one a little bit higher, and we all have discrepancies in our face. It's normal. If you will take the face picture and you will fold it in half, it's
Mm-hmm.
never is identical. Just like your two hands are never identical, and
Mm-hmm.
your two feet are never identical. So it's normal, and we can just trick it a little bit and help it a little bit. But my really favorite part of what I do, with whatever features and tools I'm using, is that process of transformation. When somebody comes and we remove the makeup and they're like, look, you see, like I have it like this, and then I start working on it, and we draw what we are going to do first during the consult, and then we start working. And that wow moment when the woman looks at the mirror and she will scream like, oh my god, oh my god, I love it, or oh my god, you made me look younger, because we
Mm-hmm.
somehow subconsciously associate eyebrows with Brooke Shields and youth. Like there is
Mm-hmm.
something about it that, when we had full brows, we were younger. And so
Right.
when you put them and you place them and you create this visual eye lift, and woman look at herself and she loves it, that's for me like a best payment. That
Mm-hmm.
really warms my heart. I feel like I was part of something important,
Mm-hmm.
of somebody's journey, and that's really where happiness from my work is, like rewarding for me.
So okay, so obviously I'm not young, but I'm not old either, and we're all aging. But I would ask you this because I know that I've been to your beautiful spa before. For no one who's been there, it's absolutely gorgeous.
Well, thank
And
you.
I think I even mentioned to you, like I would just go even if I just sat in the lobby. And the lobby, not even the lobby, it's really like a living room slash kind of not even a kitchen. It's just beautiful. I can't say it enough.
Thank you for saying that.
As far as the website information on there, you have to go. I'm just putting it out there right off the bat. Go check it out now. I mean, and come back and watch
Thank
the
you.
rest of this, even if you don't finish. So I guess, am I saying all that? Okay, I need to back up because there's just so many things that I have in my mind. So I'm going to put my business out there. I'm just going to go there. So when I was getting married, the first thing I thought about, I'm like, okay, I'm going to be taking photos. This is a big deal. And I want to look good in all my photos. I only
Hmm.
want airbrushing if that absolutely has to happen, but I want to look
Correct.
good before that even
Hmm.
happens.
Hmm.
And so you start to kind of dig in and go, okay, do I have a line here? Do I have, you start looking at
Hmm.
things, and
Hmm.
then it's also
Through
my
magnifying
understanding.
glass, yeah.
Yes. I'm like, oh, I have a line. My husband's like, stop it. I'm like, no, but then there's this thing. He goes,
Yeah,
yeah,
yeah.
stop it. It's really not. And then everything is magnified. So for
Hmm.
me, I know you and we talked about this. Um, you try to do things that even though you're helping someone, you also try to do not organic, but maybe healthy, or give people options so that they can make the best choice for themselves. And I
Hmm.
thought that was
Hmm.
actually very interesting.
Hmm.
So I wanted to ask if you could explain that a little bit to me, like how you choose the services that you do, because you even are doing some things that
Hmm.
aren't being done anywhere else in the
Hmm.
state right
Hmm.
now. And
Hmm.
That's very awesome. That's very cool. So can we touch on some of those things if
Yes,
possible?
so I think it's coming from the whole approach. So thank you for compliment on the space. I really was trying to create the space where our life is so busy, and if we go to receive the services and if it's too rushed and you feel like next and next and next, it's really deceiving the purpose. I think the spas and med spas and locations, wellness centers should be really where the time stop a little bit and we can pause and we can really retreat ourselves. And
Hmm.
so I wanted to create the environment, and I've been always very sensitive to that. I always wanted to create the environment where when you come, you feel like you are um, you are able to rest and you are princess of the time. So this is where the name of the Princess Street is coming from. But it's also important that you can unwind and feel comfortable, not just being
Hmm.
on a sterile environment. There is a lot of modern spas, and they're beautiful. Don't get me
Hmm.
wrong, but they feel very sterile. Our medical room is very sterile, but the environment where you come, you want to sit and unwind and feel comfortable. And so the time that I take with the clients to find out what is the proper recommendation and service that they should receive, it's coming from really their best interest. I'm not looking at the money making approach because I'm not gonna be helpful to client and customer and recommend them treatment that will give me money and they will never come back again because it will not be what they're looking for and it will not be what they need
Hmm.
necessarily. And it's also approach to, like you might not like something about yourself, and
Right.
if I will tell you, yeah, but you need to work on your Crohn's feet, and you are like, yeah, but I don't like my forehead. Yes, I can recommend what I think it's important, but if you walk out and your forehead is still bothering, you will go else and have your forehead treated. But we are trying to find out what is the proper steps of addressing those. And so
Okay.
it's not just Botox or fillers and injectables that are very popular in the market, but we also don't want to all look the same and we don't want to create this quick cookie cutter look. We have trends, yeah, I know Kardashians are beautiful and they work on their styles and trending and girls want to look like that. But will those lips look good on you? Will
Right.
that look nice on you? Will those brows look good on you? Is it mixing, matching with what you have going on with yourself and your natural beauty? So I always want to bring the natural beauty out. And so I look at it from several angles. I look at your skin and I'm trying to see how we can address your skin, how we can enhance your skin and work on your skin so it can start growing. So growth factors are a huge deal. And microneedling, it's a huge deal of what we are doing because now you're regrowing new skin of your own. So if you look at microneedling and then putting growth factors from your own blood in, that's phenomenal because it's almost like turnover of the ground and
Hmm.
then sowing the seeds of what helps you replenish. And then we can look, okay, is there something that we need to inject? Because that's just the step two. Because if we work on a skin first, you might need less injectable. So you are
Okay.
bringing less foreigner things in, which for me, it's always the better protocol because anytime we bring something foreigner, our body is not necessarily always welcoming it and it's not always necessarily happy with it.
Okay.
So that's one way. And then we look what we can do with the color and what we can do with the tone of the color. So a woman that had acne scarring, microneedling is phenomenal
Hmm.
for her. If we are looking for skin tightening and collagen induction and regrowth, we are looking at that. If we are looking at hyperpigmentation, okay, is it better to bring the chemical peel now
Hmm.
and then work on the protocol so you have a better absorption because we remove that old layer, or if we can recommend IPL laser treatment. So it's a lot of it. And then we also look at the client coming in and ask them about their lifestyle, what they're eating, what they're doing. Are they hydrating enough? This is your
Okay.
your forte. So do they
Right.
need bioidentical hormones? Is this a woman that is aging and everything is drying? Joints are drying, skin is drying. So if we just work on a skin and we don't address the internal issues, which we have phenomenal Dr. Sila Dopalt. She's surgeon, she's OBGYN, so we can help women with the vaginal dryness. So it's not just the face, and it's not, you can compartmentalize face from rest of the body.
Okay.
So, and the lifestyle plays a big role on that. So now we can educate the client coming in and help her address all these issues also internally. And I think it's really VR system. So, and then we talk about meditation, and then we talk about how we deal with stress, because stress is huge factor on our aging,
Mm-hmm.
and our blood pressure, and in our skin as well. So all those play together. Did I answer your question, Laura?
You did. Um, okay. So now a couple of things come up, I pop into my
Mm-hmm.
head as soon as you say that. So I'm gonna start with this one first. Collagen.
Mm-hmm.
So it's my understanding that as we get older,
Yeah.
the little fat pads in our face, they
Mm-hmm.
thin out, and so
Mm-hmm.
we don't have that the plumpness. We don't have any
Yes.
of that.
Yeah.
So can we talk about the effects of that, and does it
Yes.
make sense that we take collagen, and like does any of that help? And you talked about the micro. So can we go there just for a moment? Can we talk
Yes.
about that?
So this is really important. Before we go, summer is beginning, and I know because of the pandemic, a lot of women have more time. And I am, my nationality is Hungarian. I tend really fast. I turn yellow very fast. You can see it on me.
Okay.
Um, but I want to educate everybody. SPF your face as much as possible. Use a product with SPF, because the moment UV rays hit it, there is no replenishment. Like the UV rays can do such a damage to
Okay.
all what we want to prevent from happening and losing as we age. So that's the number one step that we need to do on a regular basis. If we
Okay.
go out, face need to be SPF, period. Non-negotiable with me.
Okay.
Um, second thing, second thing, yeah, it's really, really important, because you still will get the color, but you are protecting that skin and you're protecting collagen from being really damaged. And when you damage with UV rays, it's really difficult. Um, and then second thing is microneedling itself. It's unbelievable tool for replenishment. You
Okay.
can take collagen internally. Again, you are giving it fuel from within and inside. But
Mhm.
microneedling itself, it's phenomenal. I am not big fan of the rollers, and I will tell you why. Because
Okay.
if you look at the microscope and you look at the spinning rotation of those tiny needles,
Mhm.
as they roll, they flick and they create these like little cuts. Where microneedling is very nicely 90 degrees. We pay very close attention how we do it. In our facility, I've seen a lot of facilities rolling and dragging the microneedling pen. No, we go very gentle and we go space by space, nicely 90 degrees, because we wanted those needles to create nice micro channel. So then micro irritation and micro injury happen on the skin. So
Okay.
skin will be like, oh my God, I am hurt. I need to fix it. And when that is happening, the skin start healing itself and
Okay.
it's working itself. But the second step that comes with it now, whatever we put in, if it's your growth factors from your blood work, if it's the exosomes, that are very pure, or if it's the mesotherapy and any product that we bring in. And I love working with the Swiss brands because they're so pure. I really am big fan of Swiss everything because it's so unique to the world. So I like to work with them, and we transdermally bring them in, and now they can do their magic. And that's where collagen replenishment happen. That's one of the system. You can also achieve it with the laser treatment. It's a little bit more abrasive in a way. So, but everybody has different preferences. So, and not everybody is willing to face the blood process with microneedling.
Mhm.
So, laser might be better for them if that's
Okay.
what they are going for. So, again, you are meeting skin conditions, especially if there is hyperpigmentation, which we call age spots. IPL is probably a good option for them. So it's two different way of approaching and two different altered results, but you can do same thing pretty much. And then
Okay.
plasma pentightening, it's a third
Okay.
one,
All right.
and you create microburns that you create with electricity. You are not really touching the skin, you are
Mhm.
above the surface of the skin, but the results are tremendous. And I do test everything on me before I bring it in. I am really big advocate of knowing what I'm getting my clients into. So I am the guinea pig of every procedure.
Right.
And the plasma pen, upper eyelids, lower eyelids, all these areas, unbelievable, unbelievable.
Okay. All right. So I'm going to tackle something else here. I'm going to take a turn. And what I will say, if you're okay, so the first thing I will start with is I will say to parents out there, if you have children and younger ones, you might want to have them leave the room right now because I'm going to ask Marika about something specific that she does in her spa,
Mm,
and it's information that's for mature audiences only. But I'm going there with you. So we talked about it, as we get older, regardless of whether you're older or younger,
mm,
you have a particular procedure that actually caught my eye when I first
mm,
met you, and I
mm,
saw it in your brochure, your
mm.
pamphlet. I believe it's the O shot or something
Yes.
to that effect. Can you talk about
And
that
yes.
one?
So this is really. I'm 47.
Okay.
I am never shy about my age, because I think we should be proud of every year we gain and we experience and went through, and celebrate it. And um, so vaginal rejuvenation, it's huge, and I love that times are changing, because this used to be very taboo, and
Mhm,
we women, like we thought we are coded to bury children and become a mothers, and our pleasure and our experience with our feminine world was always kind of like swept underneath of the carpet by the nature and dominant male world. But you know what? We are gaining our sufficiency and independency in our orgasmic world back, and it's really important. So when menopausal changes, what is happening? The dryness that is happening on a skin and a joint is also happening hormonally in the vaginal area,
mhm,
and it brings the pain of intercourse, and it brings the pain of not being able to have a successful orgasm experience. And I'm also originally trainer of psychotherapy, and I love that I can talk about this freely because sex therapy was huge part of my work. And
mhm,
so women, also after childbirth very often have urinary incontinence that is
mhm,
caused by all what happened during the pregnancy and labor.
mhm,
And it's topic that is not very freely being discussed. But when I mentioned to women that I was one of those that I sneezed and I peed, you
mhm,
know, women giggle and they're like, I know, tell me about it. So I would be the one crossing my legs, just God forbid I will sneeze, and make sure that I go to the restroom all the time frequently. And I would always visit the restroom super frequently because of that. And that's one of the things that caused us. So we when I had my first shot of the growth factors that was collected from my blood and reintroduced to the clitoridal area and urethra, I was blown away because it was instant. I
mhm,
had no urinary incontinence immediately.
mhm,
But what was very interesting too, and I am very happy in the orgasmic world, I have to confess that luckily, I am very fortunate, but I was blown away what enhancement that did to me. Oh, obviously I get excited.
yeah.
What enhancement that did to me on a experience of sexual intercourse. So I was blown away, and I received this text from the client that came to us, and she was confessing that she hasn't been able to orgasm for like 3 years, and it was always difficult since she hit the menopause. And we did the procedure on her, and she was texting me, and this is where it gets you again so excited. She was texting me and she said like, oh my god, I finally was able to have an experience orgasm. My boyfriend was so excited and I was so happy because we want to be happy and intimate in a bedroom,
Mhm,
and we want to be happy if it's with the spouse and partner or if it's with our own selves. Like we want to be able to experience the sexual happiness. That's part of who we are,
right.
and this tool helps with that, and it's really unique. And we also need to look at the profile of the client, if it's hormonal, this balance if Dr. Sila has to, recommend her bioidentical hormones or any other help that she needs. But this specific injection, it's phenomenal and it's really very unique, and it's like we numb you, it's very painless. The only experience that we experience with the pain is actually when you feel the growth factors moving in the tissue, like because they start traveling because it's fluid.
Mm-hmm.
But it's less painful than pap smear.
Mm-hmm.
I had one done.
Pap smear? Okay.
Yeah, it's less painful. So it's really, we had it like, I had my first one about 3 years ago, 2.5 years ago, and the second one I offered my body for science for experimenting and practicing of other technician.
Mm-hmm.
But it's unbelievable. So I really highly recommend it, and I am very grateful that we are in an era that we women, we are taking our pleasure back,
Love it.
and we don't feel like, okay, I am in a menopause and I don't need to experience happiness anymore. No,
Mm-hmm.
no.
So let me ask you this. So you have a doctor there
Yes,
with you,
yes,
right?
yes,
So people
yes,
should understand that it's not just you're
yes,
going to walk into a spa. You
yeah,
really,
yeah,
both of you, you're both
yeah.
professionals and
Mm-hmm.
experts at what it is that you do. This isn't
Yes,
something that
yes,
you woke
yes,
up one morning and said, you have extensive training.
yeah.
So we talked about you, and can you tell us a little bit about the doctor that's working there with you?
So Dr. Sila Doppelt is, first of all, she's my very dear friend for over 11 years now.
Mhm.
But she's very seasoned. She worked in a Wellesley hospital. She worked with women most of her life. She's very skilled surgeon. She's been in a practice for over 40 years now.
Mhm.
And so she's seen everything. And it's very interesting because when I was talking about bringing her potentially on board, I by accident encountered three females that she delivered their babies.
Mhm.
And they're like, oh my god, she's the best, like, oh my god, I love her. So she's very personable. I love that she's very personable with clients, and she also is very skilled on recommending what is again best for them. And
Mhm.
naturally, because of what she has been doing all her life, working with injectables was just a very nice marriage to the two venues of how to address womanhood and help women, to appear younger and feel better. And so she is very experienced. She was awarded. She has a lot of credentials. She was awarded as Woman of the Year.
Mhm.
Like you can see it on our website. And she is very easy to talk to. I love that her approach to clients. She's very easy to talk to, and very caring.
Mhm.
So she always cares that the client and patient walk out feeling comfortable and happier and receive the services that she came for. And even more so, sometimes, when we start the conversation and we talk about joint ache and then we move on and we find out there is way more behind it. So
Mhm.
she's phenomenal. I'm very, very fortunate to have her.
Okay, so um, and we're getting close to our time, but my next question to you is going to be, what do you find? What are the procedures that you do the most right now?
Right now, I think the last year, it was pretty tilted. There was vaginal rejuvenation called
Mhm.
shot. There was vampire facial and facelift. So it's basically growth factors and skin rejuvenation. We are working on branding our own. I'm very excited because
Okay.
of the Shine Med Spa.
Okay.
Um, and permanent makeup was probably number one that I
Mhm.
have done. Um, Permanent makeup, I think, is taking place because we are busy in our lifestyle. And it
Mhm.
really, even when I had my brows done, I realized I'm wearing way less makeup on my eyes in natural than I did my eyeliners with
Mhm.
permanent makeup. So less and less time I have to spend in front of mirror and focus on more on my skin and my foundation. That was probably the most.
And how long does the permanent makeup last?
So the inks I work with, it's semi-permanent, so they last up to 3 years. But what I usually do when I do procedure, I book everybody for 2 hours, and
Okay.
then I schedule them for touch up for another 2 hours. So we look at strokes that are missing or they moved or whatever is going on there. Because everybody, sometimes you flick the strokes when they are healing, and there is a process with the healing. So we have those 4 hours scheduled for the price of the cost with the client. And then once a year, I recommend clients to come back and just do color boost, because you don't want to go crispy eyebrows, blurry eyebrows, crispy eyebrows, blurry eyebrows. So we want to always look the same. And when they're freshened up, they look much better. And also, things might be changing and you might start having more droopiness. So I can elevate them a little bit, because up is good. We always want to go
Right.
up.
Yeah, we like up.
So, yeah. So, so we can see if there is anything needed to be adjusted. So I recommend people to come once a year. And, and that's 100 for that color boost. It's $150. So it's not that it will break your budget, but you always want to look the same. It's definitely worth of your time. Yeah.
Are you open right now? Are you physically open?
No,
No.
no, I am still not physically open. I was very fortunate that I had a lot of pre-purchases done.
Okay.
Clients that appreciate our services were nice, and I ran the special. I had a special for plasma pen tightening, but people can pre-purchase. And I've been bombarded by the clients asking me to come and open. I'm not open yet, unfortunately. We have to obey by the rules, but I cannot wait to be open. Paradox is we really work in a very sanitary conditions, and my location was always very concierge. So I am one of those. I don't want a people meeting there and between the services, because if woman comes for microneedling and her face is red, I don't want her to feel like she met another woman and she's like have to hide. I want her honor her privacy.
Okay.
So when a client come, the location is locked.
Okay.
Like I don't want to have a full waiting room. I don't go for quantity. I always go for quality. I always want clients to feel like it's their time.
Right.
They're there for their time. They're there for their treatment. So they're princess.
Wow, that's wonderful. So, can someone meet with you virtually? Can you have a
Yes,
conversation with them?
actually, yes, they can
Okay.
reach out to me. If you look at the Facebook, they can message me. I am responsive. They can also, call the number. I have it
Hmm.
forwarded to my cell phone number. So, which I don't know why I do that. It's my husband is telling me that it's not professional. I love being responsive because there is a lot of questions that women have after treatment.
Right.
And when I explain the procedure, I tell them, you will have this, and this. Well, it goes like that because we are anxious. We are worried. We are sitting there. There is so much information. And even when I hand them the paper of aftercare, they still have so many questions. So I follow up with text that has simplified aftercare.
Hmm.
But then I know most of the time it doesn't end there, and the client texts me, "Oh, my brows are too dark today. Is it normal?" Yes, it's normal, because now it's not color that I inserted. It's your
Yes.
dry wound that, when you scratch yourself, it's bright red. But then when it heals, it's port wine color, and
Right.
then it's brown.
Right.
So you don't see color of brows, you see brown of scabbing.
Right.
So
Right.
it's like, but it's important for me to be responsive to them, because it's not just that I catch them and go to treatment, like I am
Mhm.
there in the journey of healing with them. So it's really important. So yeah, I'm probably more responsive than I should be.
Yeah. Well, that's okay. I mean, I am similar, so I understand it completely. You want to be there for people, and so in the midst of everything that's been going on, what's one piece of advice that you would give everyone out there today with regards to taking care of themselves, and what would that be? And I'm asking everyone the same question, and I'm
Mm-hmm.
getting some interesting
Mm-hmm.
answers.
Mm-hmm. So it will be bundle if I can. I will be fast, but it will be bundle SPF
Okay.
because summer is coming. So it's all
Yes.
about skincare. Replenish. Anytime you do anything, replenish. Definitely make sure you clean your skin every night. And I know even when you don't wear makeup these days because you are home, there is so much pollen, sweat, dust, and everything that comes to our pores. So clean, clean, clean your skin every night nicely, gently. And anytime you strip it, use toner. I found out a lot of women are skipping step of toning.
Mm-hmm.
And it comes from probably thinking toners were alcohol based in the past. No, use a toner. Toner is the marriage bond between what you did to your skin, and now you need to bring it to the pH balance back, and what you are going to apply so it seals together and hold.
Okay.
So tone,
Okay.
replenish, and
Mm-hmm.
protect.
I
That
like
will
it.
be my recommendation. And
Oh,
take
that,
your time for yourself.
okay. All right. Well, everyone, this is Marika Grantham. I'm Laura Williamson, your host from Bare Fitness, your personal trainer and Pilates instructor. So, our contact information is below. See it on the screen there. You can see all of our information and reach out to Marika. She's got some good stuff going on over at Shine Med Spa, and I'm telling you, you'll feel good going in and coming out. I guarantee it. I've been there myself. It's worth the visit. At least have a conversation with her. Again, Marika, this has been a pleasure, and I hope that we can have you back again, and
And I
we'll go
hope to
from
have
there.
you in our place, to interview in our place.
Or you don't even have to ask. You just need to give me a day and a time, and I show
Well, yes, let's do that. But I'm so honored. Thank you for having me. I so appreciate that we could talk to audience this way, and interact with people this way. That's been really pleasure.
Yeah, thank you. All right, everyone. We're gonna see you next time. Signing
Yeah.
off, and
Bye.
take care.